So our team members are Amandeep Kaur, you Kaur as myself, Nikita, Manpreet Kaur, and Amanpreet Singh. This presentation focuses on the community assessment of the homeless population in urban centers like Toronto, a marginalized group in Canada. This was taken from the Canadian Alliance to End Homelessness. So, why this committee was chosen by our group members? Because homelessness is an ongoing issue in urban setting with many lacking stable housing. And individuals facing homelessness experience a wide range of health challenges and their needs are often underrepresented. Also, this assessment identifies their health needs, current services, and opportunities for improving community health promotion. Next is identifying the community. So, first, let us define the homeless population. Homelessness includes individuals without stable, permanent, and safe housing. This population may live in shelters, temporary housing, streets, or other insecure environments. Next is community parameters, that is the location and the statistics. So the location, urban centers like Toronto where homelessness rates are high. The statistics, approximately 8,700 people are homeless on any given night in Toronto. This information was taken from the City of Toronto 2020. And 60% are unsheltered, residing in streets, cars, or abandoned buildings. Vulnerabilities, high prevalence of mental issues, substance use, and chronic conditions, and indigenous peoples are disproportionately affected.
So next we will be discussing about rationale for assessment approach. This slide explains why choose specific assessment methods to better understand the needs of the homeless population. The homeless community faces significant health disparities. For example, limited access to healthcare due to financial constraints, lack of health cards, and mobility challenges. Next is higher prevalences of chronic illness such as respiratory diseases, diabetes, and cardiovascular disease. Increased mental health struggle and substance use issues often go untreated due to stigma and lack of support. Many studies, including Flaubert et al., emphasize the importance of targeted interventions in addressing health gaps among homeless population. Conducting a thorough assessment ensures that policymakers, health care providers, and community organizations have accurate data to improve service delivery. The sources of information include Street Health Report 2020, which offers first hand data on healthcare barriers and chronic health issues within the homeless community, highlights the need for better mental health support and harm reduction services. Then the City of Toronto Homelessness Report 2020 shows an overview of Toronto's homeless population, including demographics and living conditions. It estimates that around 8,700 individuals experiences homelessness every night in Toronto. Then is Public Health Agency of Canada, which presents a national data on homelessness, showing broader trends and gaps in social services. The next is StatCan Review. It offers uploaded statistics on homelessness across Canada. It helps identify rising trends such as increasing number of youth and seniors experiencing homelessness. By using data from these sources, we ensured that assessment is evidence-based, accurate, and capable of driving meaningful policy changes. Next, we will be discussing community strengths and challenges. When assessing any community, it is important to identify both strengths and challenges to understand what is working well and where the improvements are needed. So now, firstly, we will discuss about the community strengths. First are the existing support programs. Organizations such as the Salvation Army, CAMH, which is Center for Addiction and Mental Health, and Street Health play a crucial role in offering mental health and addiction services, free healthcare clinics, food banks, and temporary shelters. These programs help reduce health disparities and provide basic necessities to those in need. Then is rising awareness and advocacy efforts. Events such as Homelessness Awareness Week and initiatives by advocacy group brings attention to the homeless issues. Increased media coverage helps reduce stigma and encourage public support for housing first policies. Then are the community challenges, which includes limited healthcare access. Many individuals lack proper identification, making it difficult to receive medical care. Transportation challenges prevent them from reaching healthcare facilities. Mental health services are often overburdened, leading to long time waits. Then is social exclusion and stigma. Homeless individuals face discriminations, making it harder to reintegrate into society. Employers may be hesitant to hire individuals without a fixed address, increasing long term employment rates. Then the next is severe housing shortage. The lack of affordable housing is one of the biggest contributors to the homelessness. Rental prices in Toronto continue to rise, making it nearly impossible for those with low incomes to find stable housing. Government stabilized housing projects often have a long wait list, leaving many individuals in precarious situations. By understanding both the strengths and challenges, we can develop more effective strategies to improve healthcare access, reduce homelessness rates, and create a more inclusive society.
Hi guys, so now I'll be talking about capacity building strategies. To create lasting solutions, we must invest in capacity building strategies that strengthens community sources. So, enhancing community resources, this includes expanding mobile health services to ensure medical care reaches those in need, developing affordable housing projects to provide stable living conditions, and engaging stakeholders such as local governments, advocacy groups, and training and providing training and education. By fostering partnership and offering targeted training and education programs, we can empower communication to take sustainable action. Together, these efforts build a foundation for resilience, ensuring that individuals receive the support and resources necessary for long term success. So, these were the capacity building strategies. In this slide, I'll be talking about stakeholders, gatekeepers, and communication. So, collaboration is the key to meaningful impact. Our stakeholders, including the homeless individuals, NGOs, government bodies, and healthcare workers, they play a crucial role in shaping and implementing effective solutions that we provide to our people. Gatekeepers, such as community leaders and policy advocates, help to bridge this gap between those in need and the resources that we have available to us. Clear, consistent, and compassionate communication among all the parties ensure that services are accessible, responsive, and impactful. So, by fostering dialogue and trust, we create an ecosystem of support that drives lasting change and improves the life of other people. So, this is what we discuss in the stakeholder, gatekeepers, and communication, which is the collaboration is the key to success.
So I am going to talk about community health promotion plan. So our goal is first one is improve access to healthcare service and housing. It include a remove barrier like lack of IT, transportation and discrimination, ensure access to preventive and emergency care and housing support. So the next point is reduce stigma and promote inclusion. It include address social inclusion through education and awareness, foster a supportive community by challenging negative perception. So the third point is support mental health and substance use treatment. It include expand access to mental health service and harm reduction program, improve overall well-being and reduce long-term health issue. So the strategies include outreach clinic. It include mobile unit provide primary care, vaccination, mental health support, and referral. Integrate harm reduction service like needle exchange and overdose prevention. Second point is public awareness campaign. It includes use media, event, education to challenge and stereotype and promote inclusion. Advocate for policy that improve healthcare and housing access. The third point is partnership with indigenous organization. It includes provide culturally safe care through indigenous health and housing program, integrate traditional healing and sport service for long-term well-being. So, in this slide, I am going to talk about policies and intervention. So, the first one is sporty policy. It includes reaching home strategies. A federal initiative focused on reducing homeless through housing support community program using a housing first approach. So, the second point is encampment strategy. providing outreach service, temporary shelter, and long-term housing solution for individuals living in encampment, reducing forced eviction. So the third point is harm reduction program. Program like supervised consumption site and needle exchange aim to reduce health risk, prevent infection disease, and lower overdose death. So next, I am going to talk about gap in policies. So the first point is incontinence service across region. Service vary by location with the rural area lacking adequate healthcare and social support. So the second point is limited indigenous program. Indigenous population face homelessness at high risk rate but lack culturally tailored service. So the last but the not least, need for long-term affordable housing. Current policies focus on temporary shelter, but permanent affordable housing is needed, especially in cities like Toronto.
Good morning, everyone. I hope you all are clear with our presentation. And I would conclude and reflect by that point that homelessness is not just a social issue, it's a complex public health challenge that demands a collective, multi sectoral response. As a future nursing leaders, we play a critical role in addressing that. How First point is like nurses are the key players, how they are key players in advocating for health equity, delivering trauma informed care, and recognizing the housing as a fundamental human right. Moreover, addressing the homelessness requires empathy, equity, and strong community partnership to create a sustainable change. As we stepped into a leadership roles, we must dismantle the stigma surrounding the homelessness and push for inclusive, effective solutions that address both the health and social needs for the vulnerable population. By fostering the collaboration and advocacy, we can drive a systematic change. The change would lead to the better outcomes of the experiencing homelessness. To conclude, I would say addressing homelessness requires more than just providing shelter. It demands empathy, advocacy, and a collaborative effort across the sectors. As a future nursing leaders, we have the responsibility to be the forefront of this change, pushing for the equity and the long lasting solutions. I hope you all are clear with the presentation and you enjoyed it. These are the references which we have used in a PPT. I hope we have made our point clear and thank you for being patient for listening us. Thank you and have a nice day.